Good morning. Welcome to today's Education Symposium on Prostate Cancer. I'd like to welcome each and every one of you for this Symposium on Prostate Cancer. My name is Dr. Artie Shelton, and I'm a member of the PHEN, Prostate Health Education Network, and I'm also a member of the PHEN Survivors Network. And I'm here to be the moderator today for the symposium. On behalf of Thomas Etherington, who is the president and founder of PHEN, once again, I'd like to welcome you. Also, I'd like to thank the Reid Temple AME Church for really hosting this symposium for us today. And would like to thank, Reverend Dr. Lee Washington, Reverend Watley, also Reverend Deck, and also Reverend Darrell Williams, who I'd like to say a few words of welcome on behalf of the church.
Good morning. We're excited to have you here this morning at this 5th annual rally as we try to educate and make you aware of prostate cancer and the ramifications that it has on African American men. On behalf of our pastor, the Reverend Dr. D.P. Washington, and our executive and managing minister here, Reverend Matthew L. Watley, and myself and our senior minister, the man Reverend Joe Deck, we welcome you on this morning. We pray that this time together will be informative, that it will be enlightening, that it will be empowering, and that we will walk away with a better awareness of what God has given us information on how to deal with our personal health, especially as men. So we just look forward to what's going to be said and what's going to be done, interaction that we have this morning as we all are educated and made more aware of the effects of prostate cancer. Once again, welcome. God bless you.
Okay, as I said, on the slide here, you can see this is the host churches. We have about 26 churches that right now within the PHEN network, and we're starting out with 7 of the churches as we try to have this symposium. And once again, we'd like to thank the host church for supporting us. I also like to thank, on behalf of PHEN, we have Dr. Kennard here from PHEN. Also in the back running our slides is Darnell, and also we have Clarice Green, who's been supporting us, who's local. The next slide, please. So once again, we'd like to thank the church, Reid Temple AME Church, for really supporting this symposium. Next slide, please. One of the things next slide. As I said, I'll be the moderator. Next slide. One of the things that PHEN, what we'd like to accomplish, or the goal of why we're here today, is to increase the knowledge and understanding about the prostate and prostate health. And we're here to focus on reducing the prostate cancer epidemic in Black American men through increased knowledge and action. And as Tom Farrington says, knowledge is the best defense against prostate cancer. And it's this knowledge that really somewhat helped me, that had I not had knowledge or information about prostate cancer, probably I would not be standing here with you today. As you saw, as the moderator in one of the slides, I'm a retired military officer, and I served as the medical hospital commander in Mogadishu, Somalia, in combat. And during that time in combat, I saw more death and dying in 4 months in combat than my entire 21 years in the military, and that as a doctor, as a physician. And after I came back from Somalia, I said I never want to be in combat or war again. Well, my doctor is a very jovial person, and so after about 2 weeks, he hadn't called me, and I called him and said, "Hey, how was my results?" And I could tell from the way he answered the phone that there's a problem. He said, "Artie, you have prostate cancer." And at that time, I underwent surgery, and I said, once again, I'm at combat and I'm at battle again, but this time the killer is within, and it's prostate cancer. So why are we here today? We're here to talk about what we need to do and about this epidemic of prostate cancer affecting African American men. We, as African American men, have the highest rate of prostate cancer, the highest rate, not in Maryland, D.C., or Virginia, but in the world, and we have the lowest survival rate. Prostate cancer, especially among African American men, is a disgraceful tragedy that needs immediate action and drastic attention to resolve this. This year, it is estimated that approximately 230,000 men may be diagnosed with prostate cancer. And there's a possibility that they expect about 29,000, 30,000 men that will die of prostate cancer. Every 5 minutes, 2 men are diagnosed with prostate cancer, and approximately every hour and a half, African American men die from prostate cancer. And if we can catch prostate cancer early, it can be treated. But the main thing what we need to do, we need to make sure that we empower our African American men with knowledge so that they can go and have the routine screening, PSA, and also the digital rectal exam. May I have the next slide, please? And this is what PHEN is all about, Prostate Health Education Network. This is Tom Farrington, and PHEN was founded in 2003. Mr. Tom Farrington, in 2000, he's a successful businessman, and he had an international company, and he found out that he had prostate cancer. And during that period of time, he went to find information about what he needed to do for treatment as an African American man. He found that there was no information that really impact on, that was very informative for African American men. So in 2003, he formed the PHEN, Prostate Health Education Network, and with the mission to eliminate the African American prostate disparity. Next slide, please. Currently, Mr. Farrington is a 13-year prostate cancer survivor. PHEN, we have Rally Against Prostate Cancer, or RAP Cancer, and is a set of dynamic and highly visible national initiatives established to implement the organization's overall view. Next slide. And PHEN's armament, of how we're going to try to decrease this epidemic impacting on African American men with prostate cancer. We have a PHEN survivor network of men, that have survived prostate cancer to go out in the community and also to network and to really inform the public about prostate cancer. We have a monthly support group meeting, to talk among men that, have been diagnosed with prostate cancer and also to answer questions. Each year, we have, since 2005, we have the annual African American Prostate Cancer Disparity Summit, where for 2 days we're meeting on Capitol Hill and also with the Congressional Black Caucus, so we can talk about the disparity of prostate cancer, within African American men. And so we'll be hosting it again this September, and we'd like to invite, all the men and their wives or family members to attend that. We also have PHEN online television, where from your home, individuals can be provided information about prostate cancer. And we're having for the fifth, as Reverend Williams said, the 5th annual prostate cancer rally. And what this is that we're asking all churches that during their normal church service for the pastor to recognize in the congregation all the men that have been diagnosed with prostate cancer and survived prostate cancer, their family members, and also those who have lost loved ones from prostate cancer to, in a sense, come to the altar and join hands for a prayer of healing, for healing and support. And so this will be the 5th annual rally that we're hosting. Last year we had 200,000 individuals to participate in that. And this year we're trying to reach 1 million individuals, in regards to the prostate rally. PHEN also have a monthly treatment and clinical trial newsletter, electronic newsletter that we send out. Next slide, please. PHEN's Father Day Rally, as I say, is a grassroots campaign to educate and mobilize Black American in the fight against prostate cancer. And this is in partnership with the churches. Next slide, please. And as Tom Farrington says, those most impacted by prostate cancer must become the most knowledgeable and active. And as I said, this is the symposium that we're hosting now. It's in 7 cities. Tom Farrington is in Philadelphia right now, attending one of these symposium. Next slide, please. These are some of we have about 26 cities that are involved, always from Los Angeles here to the East Coast.